So I'm now about 11 days since the cochlear implant surgery. So today I'm just going to talk a little bit about how that all went and some of the experiences I've had since then. So obviously I was quite nervous on the actual day of the surgery, not really knowing what was going to happen, and especially once I woke up from the actual surgery itself. But all in all, it actually went a lot better than I thought it would. Um, So when I woke up from the surgery, first thing I noticed was the worst tinnitus I've ever heard in my entire life. I was actually quite concerned that that was going to be the new norm for me, but thankfully that subsided as the time went on. By the next morning, it had actually subsided to a more reasonable level. Um, so the left side, the left ear was bandaged up. That dressing and bandage came off the next morning at about 7. It was probably, I think it was about 7:30 in the morning. An E.N.T came in and removed that dressing, and they were actually quite happy with how the wound was healing up. So that was all good. Probably the more noticeable thing though was I had the most ridiculously sore throat. Even to this day, so we're now about 11 days post surgery. Even now, my throat's actually quite sore, and that was actually due to the tube they needed to put in down my throat during the surgery for respiratory, for to help me breathe and that type of thing. So I think that banged me up a little bit either when they were putting it in or when they took it out. I actually remember waking up from the surgery and finding that my right lip was quite numb and swollen. And I actually had a bit of a panic attack because I thought, oh no, I'm paralysed on that side of my face. But then, sort of, after about 30 seconds, I got, hang on a second, I did the surgery on the left side and my right numb his lip, so that's not quite right. So I spoke to the nurse about that, and she said, no, what they've done is when they've taken the tube out, they've probably banged your lip a little bit, so that was all well and good. In terms of pain, it wasn't really much. They prescribed me endone, which I was to take sort of when needed, and then just Panadol in between. There wasn't really much pain from the actual surgery side itself, but oddly enough, probably maybe about 3 or 4 days after. Actually, no, it was probably about 3 or 4 days actually after the surgery. I started noticing a lot of pain within my ears, which I thought it's either a eustachian tube dysfunction or some sort of middle ear infection. So I rang the emergency department at the E.N.T hospital, and they said, look, just keep an eye on it. If it's definitely pain, you'll need to come in. We'll need to have a look at that. So I ended up seeing my local doctor, and he prescribed me amoxicillin and Panadine Fort, of all things. That then took me into the next day, which was when I had my 1 week review with the E.N.T at the E.N.T hospital, and she had a look and everything was proceeding quite well. She had a look inside my ears, and she said there was, obviously signs there that, of some sort of minor trauma because of the surgery, but nothing wrong with taking amoxicillin, so I've continued doing that, and the ear infection has subsided, so that's all well and good. Switch on days in another 3 or 4 days, which I'm obviously quite excited and nervous and anxious and all of the above yet again in regards to that, because that's what it's all going to be about. But look, I am pretty optimistic. Everything so far has, proceeded really well. I was really quite concerned that I was going to wake up from the surgery and be told that they couldn't actually put the implant in either all or part of the way, or that there was some sort of problem that occurred in the surgery. A lot of the symptoms that people have spoken about after cochlear implant surgery, such as loss of taste and numbness in the face and tinnitus and headaches and all that sort of thing. I haven't experienced any of that, so I've actually been quite fortunate. So hopefully things continue along this path. And probably the next thing that I'll be talking to you about is going to be the actual switch on day, and everything that happens from there. But at this point, everything going really well, and I'll keep you updated. Thanks.